Welcome, everybody. I'm Jenny Cover, and I'm the board chair for Axis. I'm also the mom of a 38-year-old who was diagnosed prenatally with 47XXY. He lives independently in another state, and he is concerned with improving his executive functioning all the time. I'm also a retired social worker, and I focused on transition to adulthood in my various clients, who included a number of people with extra X and Y chromosomes and some with missing X chromosomes. And I know that young adults with these variations often find it challenging to manage all the complex tasks and skills that are required in coming to adulthood. So this is an excellent presentation for both parents as well as self-advocates. We have quite a distinguished team here making our presentation. Rebecca Wilson is a psychologist, and she's a clinical professor at Children's Colorado Hospital. She has a long history of working with the Extraordinary Kids Clinic and also with Axis for many years. Sid Martin is an occupational therapist, and she's worked with the Extraordinary Kids Clinic since it started. And Morgan Jolliffe is a neuropsychology fellow at Children's Colorado. Much of her work has focused on supporting transition to independence, where executive functioning is critical. They will make their presentation, and then we will take questions for about 15 minutes. If you are used to using the chat, which is in the bottom banner along the bottom, we prefer that you actually use the box that says Q&A, and we'll try to get to as many questions as we can during that time. So I'm going to turn it over to Morgan and Sid and Rebecca, and they will put their slides up and start discussing them.
Thank you so much for those introductions. All right, can everybody see my screen now? Perfect. Okay.
Mm-hmm.
All right, so I'm Morgan, or Dr. Jolliffe, and I'm here to present with this wonderful team strategies for promoting executive functioning and self-care for adolescents and adults with X and Y differences. I just want to pause and acknowledge that this is a really big topic, and there's lots that we have to say about this, but we are going to break it down. So individuals with X and Y differences are 2 to 3 times more likely to have a diagnosis of ADHD and or have broad executive functioning weaknesses. So that equates to roughly a third of individuals struggling with these skills that we're going to talk about tonight, which is a lot. So if that's you or a family member, then this talk is certainly for you. And just to clarify kind of the overlap of ADHD and executive functioning and sort of what we mean by that, everyone that has a diagnosis of ADHD struggles with aspects of executive functioning, as that is a core part of that diagnosis. But not everyone with broad executive functioning sort of vulnerabilities necessarily meets criteria for ADHD. In fact, it's very common just to have some broad challenges in these areas without having a diagnosis of ADHD as well. Okay, so what is executive functioning? Executive functioning is like the air traffic controller of the brain. That's how we like to think of it. It helps all these planes of our brain sort of take off and land safely without crashing into one another. So there's a lot of coordination involved. And as you can see in this picture, all these people are working together as a team to kind of integrate different types of information and execute a safe and efficient plan. So just like this air traffic control team, executive functioning abilities kind of involves a set of skills that help us guide and direct and kind of manage everything that we do and think, and sort of feelings, expressing and kind of managing emotions as well. Others refer to executive functioning as kind of the brain CEO or manager. So whichever metaphor you prefer, we can think about executive functioning as being those skills that help us get things done, or the mental toolbox to manage daily life. All right. And so this slide is kind of our executive functioning for the session to keep us on track. But first, we've defined executive functioning, so check. And now what we're really going to spend the majority of time talking about is how these weaknesses sort of show up and impact us every day. so that we can identify when there's a challenge in life, if it's underlying core sort of function is an executive functioning challenge, so we can kind of identify that. And then three, we're going to spend a lot of time too just going over concrete strategies and ways to manage these difficulties. So in terms of talking about like how these things show up, it's important to recognize they can show up in any of these domains. So it can show up in our behavior or our emotions or our thinking skills. And we're going to kind of go through these one by one too. Okay, so emotional control. These are the feeling parts of executive functioning. So think about kind of managing our frustration and kind of getting upset, sort of using our executive functioning to calm back down and kind of stabilize our mood, sort of shift and move on to another mood state. All those things are actually controlled by executive functioning. So these skills are essential for resilience, relationships, and just overall emotional well-being. And I'm going to tell some brief stories as we go to paint a clearer picture of some of these skills and how we've worked with individuals with these um, challenges before. So right here, this picture, we have Ellie. I'm working with her now, but I'm talking about kind of some of these skills were showing up for her when she was really little. So I just got a little cartoon of a younger child. So she was someone that's always tended to kind of lose her cool when upset, even over mild, kind of minor frustrations. When upset, it could take her a while to calm down. Other people have called her sensitive, which heightens sort of emotions in tough moments. And so Ellie's a little older now, but these challenges have kind of been stable throughout her life. And so we're working a lot on coping techniques like deep breathing, kind of counting to 10 or taking breaks, and also just being able to use um, emotion identification skills when upset, which is hard to do when we're feeling, frustrated or sad or mad. So kind of identifying those emotions and labeling them so we can communicate through them. So this is kind of emotion regulation. It is oftentimes one of the first things that kind of shows up with the emergence of executive functioning weaknesses. Okay, then another big part of executive functioning is behavior regulation. So for this, we think about the stop and think skills. So this is important for impulse control, so not kind of blurting out and interrupting or acting without thinking through the consequences. Delaying gratification, so even like long-term planning for longer-term goals, sustaining attention, so paying attention to stuff we don't want to pay attention to or aren't interested in, kind of regulating that action even. And so these skills are crucial for social interactions, for school and workplace conduct. An example to kind of remember what these skills are is this guy, Billy, up here. Billy was super hyperactive, kind of impulsive kiddo, often seen as overly energetic and at times disruptive. Teachers have mislabeled Billy as being defiant. So that can happen, but it's important to know kind of what he was really struggling with was executive functioning. He wasn't defiant. That wasn't a great kind of label for some of these behaviors. For him, we've really needed to help him expend physical activity in appropriate settings like sports and hobbies like that, or even just having access to fidgets or the ability to chew gum kind of when doing more sustained attentional activities like in school and work. And he also benefits from different strategies to remind himself to slow down and check his work so he wasn't making kind of careless errors too. And then the third bubble that I was showing in the other slide was just cognitive regulation. And so this is a lot of the thinking parts of executive functioning. So planning and organizing, getting started on stuff, something that we call perspective memory or remembering to remember in the future, like knowing when it's time to feed the dog or things like that. And so this is Marco, and he was 21, and I've been working with him on helping him sort of move out of his parents' house. He has had a hard time in sort of managing all the different aspects of adulthood. So he's really capable, but has a hard time keeping track of deadlines, knowing what to do first, kind of prioritizing stuff. It can get overwhelmed because it's difficult to do all that, kind of executing things sort of efficiently. And then he also tends to lose and forget things, which gets in the way of applying to jobs and things like that. So this is how it can show up as like in our cognitive regulation. A quick word about neurodevelopment. As you can see here, we have pictures of brain maturation over time, starting from a 5-year-old brain all the way until a 20-year-old brain. And the part of the brain that is uh, that has, oops, can you guys still see my screen? Something else just clicked. Okay. So this little white square sort of circles the dorsolateral prefrontal cortex, and that is the area of the brain sort of responsible for executive functioning. As you can see over time, there are still sort of red or orange parts, even when we get to this 20-year-old brain, there's lighter parts that show that there's still maturation going on. So this part of the brain is among the last to develop. And there's research too that for individuals with X and Y differences, these skills can come online at an even like slightly delayed pace beyond this. So it's possible that even at 20 years old, this part of the brain is still actively developing. And so I think that's an important point too, that it can be that it takes a little more intentionality and skill building to help this process along, but it's not complete by any means at 18. Okay. And the expectations are really kind of shifting. So it's a moving target to focus on these skills. And it's important to recognize that what we're going to identify as being an area of challenge might shift over time based on the expectations of that developmental window. So for young kids, we often see difficulties kind of transitioning because we're starting to expect kids to be able to kind of move from task to task. Kids don't have to initiate tasks on their own, like know how to get them started, but we expect them to follow directions. So sometimes we see challenges with kids following kind of multi-step directions and managing big emotions. For teens, it can show up as forgetfulness or impulsivity, where we start to expect teens to manage different classes in middle school and in high school, different demands where no one's sort of organizing all the different deadlines. And so, with that increased demand at this age, we see more kind of forgetfulness, procrastination. And then for young adults, tons is expected of these young adults. So, it can manifest as difficulties sort of with the organization of a much broader form of expectations in young adulthood, managing social interactions and kind of following up with people and doing long-term planning to maintain those relationships. There's a lot more expected in terms of managing healthcare and our own medications and all kinds of things like that. So we want to acknowledge that there's a lot of different things that may show up on the surface, and it's important to recognize when the underlying issue may be executive functioning. So it may show up like academic weaknesses. And yes, there may be an underlying or overlapping sort of learning disability or dyslexia or something like that. But even for kids that don't have any kind of specific learning challenge, there can be academic challenges with things like writing, which takes a lot of organization and executive functioning to plan our approach, organize our thinking, kind of get that out on paper. Other academic challenges might include forgetting to turn things in, not checking work and making silly errors, especially in like longer math problems as we get older. So it could show up like academic challenges when really it's underneath the surface. That deeper iceberg is really an executive functioning challenge. And it's important to recognize this because executive functioning challenges are very workable. We have lots of strategies I'm going to get into in just a couple of slides. But it may show up like trouble with socialization, when really what's underneath is executive functioning. So common social problems could include not knowing what to say and lack of kind of initiating, or could be interrupting and making poor choices socially that cause us to struggle to get along with peers or have more conflicts, things like that. It could show up like difficulty with life skills and self-care and medication management, which all takes tons of organization and efficiency. And so when I mention these different topics, not all will apply to everyone, but if there's an area or two that you're thinking in particularly could affect your life, we're going to go through some different skills for these areas. And it's really important to know what executive functioning problems are not. So I mentioned with Billy being impulsive, people kind of referred to him as defiant and things like that. So you may have heard labels being tossed around that didn't feel like they or very accurate or fair to describe you or a family member. And so it's important to know that it is not a lack of intelligence, it's not laziness, it's not defiance, it's not trying hard enough. It's none of these things. It's often just a true neurological weakness with these skills that we're talking about, and there's a lot that we can do to develop these skills. All right. So now we have thoroughly talked about how these weaknesses can show up in daily life, and we want to spend more time kind of getting into what to do. So we're going to focus on what we call compensatory strategies, which would basically be tools that you can kind of put into place right after this talk, tomorrow, in the coming weeks, to manage some of these skills. And if the strategies that you learned tonight are hard to implement, or you need more support kind of putting them into place, then lean on some of these other supports too. There's lots of professionals that work on executive functioning, including, psychologists, including occupational therapists, coaches too. So there's different types of therapy, or even supports available through schools that can help. So if you need extra support other than the strategies we're going to talk about, there's lots of other available resources too. Self-care is also something we like to mention. There's so many demands sort of placed on all of us, young adults and beyond. So with the extra kind of technology pieces of our world where we're constantly getting pulled from activity to activity. I have an Apple Watch, and half the time I'm like, should I even have an Apple Watch? Because it's a constant source of distraction and overstimulation. And so currently, as those technology supports just seem to be getting more rampant, we can use them to our advantage, but they can also be a huge overload. So self-care and anything to kind of reduce that load is also helpful in clearing our mental space so that we have more kind of resources available for executive functioning. And then medication options are available too, for people with comorbid ADHD. So stimulant and non-stimulant options are available as well. But we'll get into the strategies. So whenever kind of first trying to address what might be the best, most effective coping strategy, we want to do kind of like a task analysis in our head of like really think about what is getting in the way of completing this task. So we want to think, what exactly are the executive demands required to complete this task? So the task could be something academic, social, daily living, and everyone wants to take a moment even to think about one executive demand of your own life that you're working on kind of mastering. We can think about these different questions as we go of, does it require multiple steps or doing multiple things at once? So multitasking. If it requires multiple steps, do I know what all those steps are? Or is there a block of kind of not knowing what all the steps are or how to prioritize them? Does the task require planning in advance? Can I manage all of that in my head, or do I need to kind of write down some notes and kind of maybe break this down step by step so I know how to attack this and kind of plan it out that way? Do I need, for this behavior, do I need to sort of change a response based on feedback from others? So that sort of gets at self-monitoring, and is there an aspect of that where I need to step back and kind of reflect on my behavior and how I might want to change that? Does this task require quick thinking, rapid decision making? Is there a way to slow that down, reduce that demand? Does it require transition or being flexible? So just thinking through some of these questions so we can really understand what are the various demands, and then that can help us select the proper kind of coping tool. So I'm going to pass it off to my co-lead, Sid Martin, who again is an occupational therapist and has got lots and great strategies that she'll start talking about.
Thank you. So I like to start with working on initiation with individuals with X and Y differences. And a lot of times I teach those individuals to look at the future thinking about what does it look like to have the task done. I spent a lot of my career working on the sequential aspect of learning a new task, and I found out that that didn't work as well. So this particular model is from Sarah Ward, and she has a website, efpractices.com. And she talks about how we have to think in the future about what something looks like when it's done. And so we start on that red column. And then we're going to go back to getting ready. What are the steps I need to do that? And then the actual act of doing the task. And I just use making a bed as a really simple example, but you can apply these strategies to pretty much anything that you would like. And then you can reevaluate at the end, how did that work? And do I need to change things, or what was easy, what was hard, that kind of thing. I often get consulted to help individuals with their morning routine because that sometimes is a challenge. And taking a shower is a big one, as well as brushing teeth. And for some reason, those are some things that are really difficult for some of the individuals I work with. I would encourage everyone to put reminders on their phone so that they can get an alert that tells them, okay, today's shower day, or I'm going to brush my teeth, and use a timer for an additional amount of time. Oftentimes, individuals will brush their teeth for just a small time. And so we'll use a timer sometimes to increase the length so that the dentists are happy with the 2 minute of brushing teeth time. So you can use those strategies. I also like to use a morning routine checklist or something like that. The important thing is to find a system that works for you and works in your family, and you can try those and use those every day. And sometimes I break up the daily routines into every specific thing that I need to get done. And that's an example of that on the right, with all the steps that have to happen before I leave the house for the day. So this would be a very detailed daily routine. And then other times we might just use even something simple as a sticky note. I've had parents help me and say, you know what, the daily routine picture is too overwhelming for my child, but I'm just going to use a sticky note and put that together for, these are the 2 things you need to get done for that day. I also use the toothbrushing visual schedule to help with individuals that are learning how to brush teeth. And sometimes it's about orienting the toothbrush, that can be really tricky and hard. And so I'll use visuals to support that so that they're more successful. When I'm teaching a difficult motor task, a lot of times I will use videos. And so a good example that I can share today would be learning how to button or something like that. And if I want to learn how to teach that task, I'm going to take a video of you buttoning, and then we're going to watch it. We're going to see how it worked. And then that perspective is very different than if I have the learner point of view where I'm buttoning on myself with a shirt because I've got to look down. And so I need a close-up of the task. So working on the videos to look at how the task is taught, and then videoing, providing a video to the individual I'm working with, and we watch it again so that we can learn, how did that go? Do I need to adjust? Is there anything that I could do differently? I will often use that to teach motor skills when that might be an area of weakness that we're having difficulty with. And medication management and organization of taking your medication is very important. A lot of times that requires an adult prompting. And so we want to take that adult prompting down to become more independent for individuals. And so often we'll use a pill box that has an alarm, and you can set those for each time of the day that you need to take your medicine. There's also, some people like to have a chart, and they can use that as well. any kind of an organizational system can work for you. Oftentimes, again, we might use the phone and have an alert set as well. And that can help with organization of taking your medications. There are lots of money management apps and planning out there. So one of them is called Mint, and that's a really great app that you can use to help with bill paying. Online bill paying is also helpful, and learning where your money is going every month and learning what you're spending your money on is very important as well. And just supporting those organization and money management skills. They do have a lot of apps out there for getting groceries, and nowadays you can get your groceries delivered or you can go pick them up and someone gets them for you. But I would encourage everyone to start to use those apps that are out there that can be helpful to make everything more independent. Oh, Mint is discontinued. Thank you. I didn't know that. Additionally, I'll work with academic challenges. So for me, one of the things I always hear frequently is that homework is just a real struggle. There is an app through the Cognitive Connections through efpractice.com, and it's 360 Thinking, and you can get that on Android or an Apple product. And what you can do is I love it because it teaches the temporal awareness of time for me. So the yellow area on that clock that I'm showing is where you want to start. And then I like to, talk through that the green area is where we're going to be when we've gotten, say, 3 math problems done. And then the red would be when we have all 6 of our math problems done. I love to use this because it's helpful to learn. Sometimes when you ask your individuals, like, how long do you think it's going to take you to get 6 math problems done? They often say, 5 minutes. And this actually helps them to learn that it actually might take longer. And then also that where they're at in completing the homework assignment, which is the beginning, middle, and end. So it's a really great app to use as well. Also, when we're looking at academic challenges, organization is a big area. And oftentimes using a computer for your weekly schedule, your daily schedule with alerts is really helpful. Some people don't like to do that on the computer. They like to use like a written format. And so you might invest in color coding and things like that to support, different projects that are due. And again, this is an area where you can put some sticky notes and tell yourself if you've got a pre-plan for homework or a project that's coming up, where you're going to be doing that. And it's a great way to have some kind of a system. The important thing would be to work on finding a system that works for you. I oftentimes am consulted with getting support with handwriting, and I'll use graphic organizers to really help get the thought process, because we know everyone has great thoughts here, but getting it down is really difficult, and handwriting can be really avoided oftentimes. So we will work on some graphic organizers. I might encourage speech to text and then some editing later. And then I also like to use graph paper to support math problems. There's a really great app out there called Cami. And what it allows you to do is almost as if you have a pencil and you're drawing on a PDF that was sent to you. So say it might be your homework that you have to send to the teacher or for a professor. You can draw some ideas on there. You can do a text box to type in it. And then you can also highlight the whole entire document and it'll be read to you. So it's actually a very helpful app to use. During enrollment in college, a lot of opportunities are there for supporting with accommodations and modifications that you may have had in high school, or you might find yourself needing in the college environment or the workplace. And so there's also an Office of Disability Services that's in every college, and they're helpful to get your needs met and give you the strategies that you can use. And there's also a parent coaching that can happen with an executive function case management coach. So they can actually meet with parents without your child, or you can meet with them separately. They can do check-ins and have facilitated meetings with your college or with your workplace. And that's a really great strategy to use. Self-rewards are just lovely. And I love self-rewards for myself. If I'm going to be working on a hard project that's going to take all my brain power, I schedule in a reward for myself afterwards. And it usually involves coffee. And I love movement. And so I tend to, as an occupational therapist, work with everyone on just what are your interests in movement and sensory needs that you need that help you to be successful at what you're doing. So I would encourage you, as you're working on different homework or different things for work, that you schedule out some self-reward time, because that can be anything from playing a video game to basketball or getting a quick snack and supporting your self-care needs, because that's really important.
Perfect. So now we'll get into a little bit more issues that we hear coming into play for our young adults and through the lifespan as well. So finding employment, maintaining employment can be a challenge. There's lots of different aspects. This first piece will be about intended for adults that are obtaining kind of first time employment. So there's lots of things to break down, but first it's important to think about making sure that there's good proficiency already with home chores and home tasks. That can build a lot of the fundamental skills for getting things done on time that we'll need for more advanced employment. So if proficiency with home chores is something that's a challenge, then we would recommend spending some more time kind of putting some of these other strategies that Sid has talked about into place to working on this one. But if you can look at proficiency with home chores and kind of check that off, then we can look at these next steps too. So after proficiency with home chores, we would think about paid tasks. So something that's kind of fail proof. So something that we're likely to be successful at. So thinking about doing paid tasks for a family member or a neighbor, thinking about what our skill set is, what we can kind of offer, and looking for opportunities like that. If that's something that kind of is checked off already, thinking about maintaining some type of volunteer position. So this usually involves like applying for something, potentially going through some kind of screening process, doing some training. So whether that's volunteering with animals or kind of working in a community garden, there's lots of different opportunities to practice showing up on time, dressing appropriately, sort of managing schedule changes and things like that, and kind of still a lower stakes environment as it's a volunteer position. And if this is something that we can check off, then we kind of move towards looking for a part-time or full-time job that's sort of well within our skill set. And then for adults throughout the lifespan, kind of looking to change careers, shift careers, or get the first time kind of full-time paid employment. These are some of the skills that we would think about. So we first recommend doing some type of assessment. There's available programs online for personality assessments, career interest inventories. This is where it gets really fun, and we can kind of dream about what are the skills that we want to kind of highlight, that strengths that we have that we want to really lean on. How can we kind of assess areas of need if there's going to be things that sort of rule out certain types of jobs? For instance, if it's difficult to have to stand for hours on end thinking about which jobs we maybe rule out because of a need that we have. So think about that kind of that intersection of what our skills are, what our personality and our interests kind of direct us towards, and then ruling out things based on needs. And so step one, we're going to show some different resources of where you can look for some of those inventories online. But once you've done that and kind of narrowed down, if you feel like there's an area that makes most sense, then we would recommend conducting sort of informational interviews. So thinking about if we know anybody in that field, we can connect sometimes with vocational kind of resources in our community that can pair us up with people in those fields so that we have a chance to learn more and kind of make sure it is sort of field we want to go into or job that we want to apply for. And then step three would be that phase of kind of preparing application materials, lots of available resources online for resume building exercises and cover letter writing tools. We also recommend just sharing those with family and friends that can kind of give general feedback. And then four, it's really important to practice interview skills. So kind of role playing that out. This could be done with parents. Sometimes this can feel touchy to practice with a family member or sibling. So, we also recommend reaching out to friends and other people in our network to practice kind of those interview skills as well. Sid's going to mention some of these personality inventories.
So when I think of personality inventories, there's some really good ones here. The Myers-Briggs is a good one, and you can get these online. And they're quite lengthy, but I think what they offer is really helpful in terms of finding out what you really like and what kind of a job might suit you better. And just what kind of a person you are. We all have to know about ourselves before we can help others and those kind of things. So I would encourage you adults in the room to seek out some personality testing. And then in knowing yourself in terms of sensory strategies or things like that, you might find that you need more movement. And that would be true for me. I'm not the sit down at the desk kind of girl. I like to be bouncing around at a gym. So that might be something that you'll find about yourself that you actually need to participate in a job that doesn't allow you to sit. And we can really rule those things out a little bit more clearly.
Perfect. And then these are some examples of like career interest inventories. So they can help us figure out if we're more, realistic in terms of our work. We want to do something outside or with our hands, or if we're kind of investigative and we want to look into something more in the science field or the medical field. Some people are more entrepreneurs, or sorry, like they're entrepreneurs, and so they want to just build something or kind of use their creative talents to kind of create something new. Others are more social in nature and want to have jobs that are working closely with people or helping people. So these interest inventories, the ONET and the strong interest inventory, are available online. I think the strong interest inventory is not free. So if you want to look for a free resource, the ONET one is our recommendation. Okay, another huge topic is social difficulties. So there's lots of executive functioning at play when navigating keeping friends and making friends. And so part of that task analysis might be with such a broad area. If our goal is to kind of strengthen friendships, starting at that very top level, like, are we having a difficult time making friends or are we having a difficult time keeping friends? So there's an entirely different set of skills kind of at play. If it's difficulty making friends, is it initiating and knowing what to say? Is it kind of working memory demands of like a big conversation and that being a lot? Is it cognitive flexibility and adapting to different social settings, or is it a self-monitoring issue, kind of noticing our social feedback? So we're going to do a real quick example, one of these task analysis. So if we have difficulty making friends and our primary difficulty is sort of initiation, we're finding that we don't have a lot of opportunities to interact with peers because we're not starting conversations at school or at work. And so things that we would recommend would be to help make initiating a little more comfortable by preparing in advance. So thinking about, in advance, who am I going to see tomorrow in my class, and kind of having a plan for things you might want to bring up with that person, or what are some things I already know about that person, or what are some great kind of questions I can ask to get something started. We can look for help with this from friends, from family members, from siblings. So, if you're going to see someone in your class, Michael is someone I want to get to know. What do I know about Michael? What are some follow-up questions I could ask? What do I want to share about myself or not want to share about myself? What are we likely to connect about? If our primary difficulty is self-monitoring, can we do some post-interaction analysis with a trusted person and think about, did that go well? How could I tell if they're interested in talking to me? Different questions like that can start to stimulate reflection after an encounter and sort of figure out what our social feedback was. If the difficulty is keeping friends, there's other executive functioning kind of skills that might be at play in those situations as well. So one may be emotion regulation. It's potentially we've had some big conflicts or we've had trouble sort of managing emotions in conflicts and in social relationships. Maybe it's an impulse control issue, burning out or interrupting or kind of making social mistakes in that way. Maybe it's a time management issue or kind of forgetting plans or not responding very quickly. We're struggling to kind of plan and organize and follow through on commitments. So any of these things could be at play. So a more task analysis, if our difficulty is keeping friends and it's potentially related to emotion regulation during conflict, doing some skill building in managing a conflict could be helpful. So some of the steps that we can break down are, waiting for the right time and place. Maybe we've tried to handle conflicts or standing up for ourselves when we've been kind of heated about something and weren't able to communicate in a way that our friend was able to really respond to without being defensive. So wait for the right time and place. Next, we kind of want to explain our side using I statements. So it's really important in a conflict to speak from your own experience and from your own feelings so that we're not putting blame on others, which often puts them into sort of defense mode and stops them from listening to kind of our side. So once we've explained our side, we recommend kind of listening, doing some repeating of what they said. It sounds like you felt this way, just to show that we've heard them. And then we can kind of suggest a solution. So next time I would appreciate it if you would do this. And always remembering that it's okay to disagree. If we have conflicts, now and again with friends, we can, sometimes even strengthen friendships through getting through a conflict because there's increased trust that's built. So if there's, these conflicts are not too explosive or too disruptive, we can kind of strengthen friendships. But if they're coming up a lot, that's when we start to struggle with keeping friends. So this is just one example of, we've identified something that's coming up, kind of a pattern. So if, social skills are something kind of thinking from those broad categories, is it making friends or is it keeping friends? And are there any recurrent patterns that are coming up and any sort of executive functioning skills that I can kind of break down to better attack that? All right. So I know we've been talking at you for about 40 minutes and we've kind of met all three of these goals, and we'd really love to open it up to more questions and discussions about any of these topics. We have some different resources too. You're welcome to kind of snap a picture of this, or our slides will be available later. So these are some different resources we've kind of mentioned throughout, and these as well.